Okay, so then when we're talking about rehab, there's going to be lots of things that we can take into consideration for our patients, and some of them are just simple walking. And when we're doing walking, you want to look at the normal gait, but also you can have them walk on their toes to get real high to strengthen, and then they can flip back to their heels and try to work on those anterior muscles. Then they can walk on the outsides of their feet, and then they can walk on the insides of their feet, and you're going to be strengthening all different kind of stuff. I will say walking on the insides are certainly some of the more difficult stuff to do. Once they get good at that, one of the things that you can have them do then is start doing toe raises, and they can start out on the ground, but then you can move them to elevated surfaces, so that way they can come up and down nice and easy and stay level, but then you can ask them to start dropping down, so that way they're getting that negative part of it, and then coming all the way up, so that way they're going through the full motion. And then you can have them change and go to single leg as they're doing it. You got it, single leg? And that's going to challenge them much, much more than just doing it double leg as they're doing this kind of stuff. And then you can move to balance, and you can have them just stand on the floor, but then as they get better, you can have them stand on things like Basu balls, and they can stand on either side. And also in the beginning, you're going to want to stand near them, so that way they can actually get onto the Basu ball, because they're supposed to be unsteady, right? So then what you would do is you would start out just having them stand, and they can have a really nice wide stance like this, and then from eyes open, you have them change it to eyes closed, and they can go about doing those kinds of things. And then if they get really good, they can start moving their feet in. But then other things that you can have them do, and by the way, this is a humongous ball, and I wouldn't normally do it with a humongous ball, but you can do lots of things. So you can bounce the ball at them, and you can change how close and how far the ball is. You can throw it above their head, or you can just do general toss stuff. And as they get better and better at it, hop down, then they can start doing things like single arm tosses and everything else. They've already done strength, we've done range of motion, we've done balance, so then we can move to doing plyometrics. And some of the first plyometrics we do are just line jumps. So you'd ask them to first go just forward and backwards, and then you would move to side, and then eventually you would move to diagonals. And you just really need to think about what kind of pain level they have. From there you can go to actual jumps for height, for distance. You can have them do skipping, you can have them do all kinds of stuff that's going to help. Okay, so for balance, a couple of the other things that you can do, or one of the big ones, is something called the Star Excursion Balance Test, also known as the SEBT. And what you're going to do is basically ask your patient to do a single leg squat, and usually we tape out a star on the floor, but they try to reach as far as they can in all of the directions. They can either do them in sequential order, or you can call out directions that they need to go to try to hit. And the idea is that every time they do this test, that they are trying to reach out further and further in every direction that they can. I would also have them do it on the opposite side, just because I think it's the smart way to do things, and that way they're training both sides as they're going through it. But that's a really functional test for people to do, because it's putting their center of gravity outside of their base of support, and it makes it much, much harder for them to do these kinds